Earlier this summer, the San Diego Teachers Union and the County Board of Education endorsed the Medical Appropriateness Project, or MAP. It's a program that rates doctors based on the care they provide while offering patients lower cost health care. To explain how the MAP project works are my guest, George McGregor, a healthcare administrator who developed the project, and via Skype, Dr. Dudley, professor of medicine and health policy at UC San Francisco. Thank you both for being here. George, can you briefly explain to us the basics of the Medical Appropriateness Project?
45 school districts and their employee associations are spending $120 million of very precious education funds treating diseases their members don't have. The research project is designed to identify the inappropriate diagnosis, identify quality physicians, and get them properly treated to save that money.
Part of identifying how to save money is a rating system that Dr. Dudley, you actually helped come up with. Tell us how this rating system works.
We take the records that doctors file with the insurance company or the employer and go through them looking for care that is not consistent with guidelines from the specialty societies or the latest science.
Give us an example of that when it comes to, let's say, cesarean sections.
So a particularly common and unfortunate trend lately is for people to schedule C-sections before you get to the end of the pregnancy. I think this is mainly done because it sounds like it would be convenient, but it turns out that if you schedule too early, it's sometimes bad for the baby and the mom. They're not ready.
Okay.
And so we need to begin to move C-sections back to when the baby was due.
Is there some concern over people not doing procedures that they need because there's incentives to the doctors to avoid costly procedures?
Well, again, we're trying to move people towards the recommendations of the specialty society. So with the C-section example, the American College of Obstetrics and Gynecology says you shouldn't do a C-section before 39 weeks of pregnancy. So that's what we're looking for, is procedures done before that. Procedures done after that are completely appropriate.
All right, Dr. Dudley, let me ask this to you, George, of you. Blue Shield tried a physician's rating system a few years ago. The California Medical Association sued them. How are doctors responding to this physician rating system?
They're responding actually much better. The system that Dr. Dudley helped come up with is actually physician-reported data, is audited by the state of California to make sure it's accurate, and it's clinically based measures. So it's far closer than other rating systems.
How would this, George, fit in with employers' existing health care plans? Is it an addendum, or will it replace it?
Really, neither. The goal is to identify good quality doctors, which the employer plans then could incentivize their members to go to. And we've got 3 years of evidence that if you go to a high quality doctor and you get properly treated, the cost declines substantially.
Dr. Dudley, can you give us a few examples of how this could save in healthcare costs?
It can save in healthcare costs and prevent complications for patients. So, for instance, if you start having lower back pain, a very common problem in our society, and you go to the doctor, that doctor should not send you off for an x-ray right away. That exposes you to the risks of the procedure, the radiation. What they should do is start with rest and then a gradual program of exercise and wait at least 6 weeks to start doing any imaging. And that lowers your risk and lowers costs.
Well, here in the United States, Dr. Dudley, as you know, we are aggressive medical treaters. Do you think that is part of the problem with healthcare cost?
Definitely. We do more procedures than any other developed society, but we don't actually get better outcomes. So if you look, for instance, at our prostate cancer care, you'll see that the majority of the people get surgery and radiation, which have potential complications here in the United States. Other countries, people often are just watched the development of complications, and they don't die any more often.
All right, Dr.
Prostate cancer is a very slow-growing cancer in most cases.
Okay, we are running out of time, so I want to end with George. I have a question for you. How do you see this MAP project working with the new health care reform laws?
I see it really working effectively with the health care reform laws by getting people properly treated. They will actually leave the healthcare system sooner, and with the additional demands on the healthcare system as a result of the increased access under the law, then there will be that capability for treatment.
All right, George McGregor and Dr. Dudley, thank you both for being here.
Thank you.
Thanks.